Good evening and thank you for tuning in to Black News Tonight. I'm Marc Lamont Hill. Tonight, we start with an update in the shooting death of philanthropist and wife of music executive Clarence Avant, Jacqueline Avant. Beverly Hills police have arrested 29-year-old Ariel Maynard in connection with the killing. According to police, Maynard allegedly shot Avant with an AR-15 rifle before accidentally shooting himself in the foot during another alleged burglary attempt. Authorities say Maynard's vehicle was caught on multiple surveillance cameras leaving Beverly Hills shortly after the shooting. Now an update on the high-profile trial of actor Jussie Smollett. On the fourth day of the case against the Empire star, a defense attorney for Smollett called for mistrial and accused the judge of lunging at her. But the judge denied the claim and motion. Earlier in the day, defense attorneys launched bombshell accusations against brothers Abimbola and Olabenjo Osundairo, claiming that they're accusing Smollett of staging his reported January 19, 2019 attack because they don't like the actor and were seeking monetary gain. The prosecution rested its case, arguing Jussie Smollett plotted the attack on himself and hired the men to rough him up. Let's turn now to Jason Meade, the former Ohio Sheriff's deputy, who is facing murder charges for the shooting death of 23-year-old Casey Goodson Jr. while he was entering his own home in Columbus last December. Officials filed 2 counts of murder and 1 count of reckless homicide as Meade was indicted in Franklin County Court today. On December 4th of 2020, Meade fatally shot Goodson, who had no criminal record and was returning home from a dentist trip to Subway to pick up sandwiches for his family, according to a family attorney. Meade, who was granted disability retirement and left the sheriff's office in June, is scheduled to be arraigned tomorrow when his lawyer has said he'll plead not guilty. Meanwhile, New York confirms at least 5 COVID-19 cases of the Omicron variant after a Minnesota man tested positive after visiting New York City. New York Governor Kathy Hochul announced via Twitter that these new cases come as no surprise and, quote, "This is not a cause for alarm." A Minnesota man who represents the second confirmed case of Omicron in the U.S. had been fully vaccinated and developed mild symptoms on November 22nd after traveling to New York to attend the NMA NYC 2021 convention from November 19th through the 21st, according to officials. Hochul says that New York State and city officials are prepared to combat the new COVID-19 strain. President Joe Biden is responding to the Omicron cases in the U.S. by rolling out a new strategy in the fight against COVID-19 as the nation braces for an unknown winter. Biden's plan includes encouraging people to get COVID-19 booster shots, requiring private insurers to cover the cost of at-home COVID-19 tests, while updating restrictions on people entering the United States, regardless of their vaccination status. BNC correspondent Jamise Price has more.
President Biden with a new strategy to battle COVID as we learn more about the Omicron variant now in the United States.
We're going to fight this variant with science and speed, not chaos and confusion.
It's a plan that stays away from mandates, but pushes more Americans to get their booster shots, making the vaccine available to all eligible adults. So far, about 20% of Americans have received their booster.
Folks, if you're over the age of 18 and you got vaccinated before June the 2nd, 6 months has gone by. Go get your booster now.
President Biden is also providing time off for federal employees who go and get a booster. This new COVID strategy also requires private health insurance companies to cover the cost of at-home COVID tests. This comes as we continue through the holiday season, where family and friends will spend time with each other.
The bottom line, this winter, you'll be able to test for free in the comfort of your home and have some peace of mind. This is on top of the 20,000 sites already around the country, like pharmacies, where you can go in and get tested for free.
Mr. Biden is now requiring travelers who enter the country by plane to test negative for COVID a day before departure instead of 3 days, regardless of nationality or vaccination status.
This tighter testing timetable provides an added degree of protection as scientists continue to study the Omicron variant. And we are extending the requirement, both internationally and domestically, to wear masks for travel on aircraft, trains, public transportation through the winter months.
The president says this new plan pulls no punches in the fight against COVID, and he hopes it unites the country. In New Orleans, I'm Janice Price for BNC.
The head of the African Union has a message for members of the international community about travel and the spread of Omicron. Moussa Faki Mahamat urges world leaders to halt and reverse travel restrictions on the continent during a joint UN and African Union conference. He said that there is no common sense reasoning or scientific evidence in the travel bans, highlighting that recently discovered cases existed prior to South African scientists publicly reporting cases of Omicron. The Omicron variant has been reported in 4 African countries, including Botswana, Ghana, Nigeria, and South Africa, according to Africa CDC. On Tuesday, New York City became the first place in the country to open supervised drug injection sites. The facilities offer clean needles and medication to reverse overdoses, as well as information on addiction treatment. Supporters say the sites are necessary to prevent overdose deaths and represent a form of harm reduction that is more effective than criminalizing drug users. Other cities have attempted to open similar injection sites, but were met with opposition fueled by questions about the very idea of providing a place for people to use drugs that are prohibited by law. Joining me now to discuss the issue is Kassandra Frederique. She is Executive Director of Drug Policy Alliance. Kassandra, so good to see you on the show. What do you make of New York's decision to open these 2 supervised injection sites? Is it a step in the right direction?
Hi, thank you so much for having me. It is absolutely a step in the right direction. New York has been fighting and talking about this issue for a very long time. The campaign actually to open supervised injection facilities in New York City started back in 2015. The New York City Mayor de Blasio actually supported and came out in support of supervised injection facilities in 2018. What we're seeing right now is that after the latest numbers of overdose has gone up by 38% in New York City. And that means 565 people, loved ones, including people in my family, have been lost in the last year. And I think what New York City has realized is that we actually need to move forward. This is not the first time that New York City has pushed forward based in science and courage. We were one of the first places to create syringe exchanges back in the early 90s. So this continues New York City really showing the rest of the country how to move forward and how to deal with a crisis.
There's an argument from some people that all we're doing is reinforcing bad behavior, that we're stopping people from being accountable for what is an illegal drug trade, that this will continue to support drug dealers, that people who are preying on our community will continue to be not employed, but continue to be working because we're not stopping the fundamental challenge of illegal drug trades in our cities. And then there are others who argue that what makes a drug addicted person ultimately leave their addiction is hitting rock bottom. And by giving them safe places to inject, by giving them clean needles, that we stop them from hitting the rock bottom that's needed for a conversion-like treatment. What would you say to those arguments?
Rock bottom is death. That's what I say. Rock bottom means that people don't get to come home. They don't get to be with their family anymore. They don't have choices. What we are trying to navigate right now is that this country has over 100,000 overdose deaths, and we want to end that. We want to curb that. We want more people to come home. And so this moment, this initiative, this intervention that we're doing is about us focusing on how do we curb the overdose deaths so we get people the opportunity to make different choices. People are consistently talking about losing their loved ones. And I think it's really important for people to understand, and why I wanted to be on BNC, is that the overdose death rate is skyrocketing and surging in the Black community. And I think oftentimes people miss the fact that we are disproportionately and starting to be really negatively impacted by overdose. And we want to curb those overdose deaths and connect people to services. And this is about creating a different pathway. Criminalization consistently exacerbates the issue that we're navigating right now. The drug supply that people are using is completely poisoned because of criminalization. The stigma associated with criminalization is the reason why people don't get help. And the thing that I often come back to is when people talk about accountability, they talk about caging people. Since 2001, overdose has gone up 600% in state prisons. It's gone up 200% in county jail. So I'm not clear about what accountability is. I think that criminalization is the way to move forward if people still die when they're incarcerated. And then when they leave incarceration, they're 13% more likely to die. So the focus, the metric has to be curbing deaths, less about what our moral feelings are, about whether someone should be using drugs or not.
So you're advocating for harm reduction as the alternative to criminalization. There are people who are going to be persuaded by that. There are going to be people who say, look, this makes complete sense. But then there is what we call the NIMBY principle. Not in my backyard. Everybody wants a SIF. Everybody wants a safe injection facility. But most people don't want it in their neighborhood. How do we, before we go, address that issue of people saying, yeah, fine, put it over there?
Mm-hmm. We need to put the SIFs where people are using in the street. So we are going to place these sites where people are already navigating public action. The places that we need to go is where the people are. We shouldn't put a SIF where no one's going to go. What research has consistently shown, just like a gym, people only go to the services that are conveniently placed to where they are already at. And so I think the conversation is that these people are our neighbors, they're our loved ones, they're our friends. And I understand why people have questions or they're scared. But what the research has shown about SIFs is that it really gets rid of and reduces the syringes that are in the street. It connects people to resources, and that it really serves the people that are already in the area.
Already in the area. Well, that makes sense. So I want to keep this conversation going because I got a bunch more questions for you, and you have all the answers. That's what y'all do. Stay with me, everybody. We're going to be right back after the break, and we'll continue the conversation with Kassandra Frederique, who's Executive Director of Drug Policy Alliance. We'll talk about what's needed to address overdose and addiction, specifically in Black communities. Stay with us. Back to Black News Tonight. We now continue our conversation about the City of New York's decision to open 2 supervised injection sites and how that relates to the crisis of addiction and drug overdose in Black and brown communities. I'd like to read a tweet by my guest tonight, Kassandra Frederique. She's Executive Director of the Drug Policy Alliance. In response to BNC's coverage of the story last night on Prime with Charles Blow, a great conversation they had, Kassandra wrote, "Grateful to see this conversation on BNC News. The recent data shows that Black New Yorkers had the highest rate of overdose deaths and the largest absolute increase rate in 2019 to 2020. That's important data to think about, Kassandra, as we talk about the use of safe injection sites as a policy response, right? A harm reduction policy response. Why are Black people, first of all, in need of this policy response? Why are we overdosing at such a high rate and a disproportionately high rate? Give us a snapshot of the overdose crisis right now.
So right now, what folks are missing is that the Black overdose rate has been growing for quite a bit. Actually, between 2014 and 2017, Black overdose went up by 230%. And most people don't recognize that because the media, usually when they're talking about the overdose crisis, have put the face of an upper middle class white person. But the thing that we always know is that my colleague Tracy Gardner says, like, when white people have a cold, Black people have pneumonia. We've been beating the drum for the last decade, last several years, really talking about the fact that we know that crisis is going to impact Black communities in a disproportionate way. When you think about the medications that are gold standard when it comes to overdose, something like buprenorphine, right? Black people are 77% less likely to get access to buprenorphine than white patients. Black vets in the VA are less likely to get buprenorphine than white vets. We're thinking about the role that criminalization plays. Black people are disproportionately arrested for drug possession, right? And so all these things are happening. We're also navigating the fact that the drug supply that people are using is poison fentanyl, right? And these things are rushing people. People don't have the access to check their drugs. The treatment facilities in our community tend to be under-resourced. And we're also dealing with the fact that criminalization, poverty, lack of housing, the education gap are all contributing issues, all risk factors when it comes to navigating Black addiction. I mean, being Black in this country is a reason enough for people to keep the state. And so I think oftentimes we miss the fact that this is a huge issue for us. And one of the things that really made it hard for media and also Black communities to miss the fact that we were getting crushed in this overdose is because the narrative erroneously has focused on prescription drugs and the fact that people thought the fact that Black people couldn't get prescription drugs because doctors racistly did not want to give them drugs because they thought we were drug seeking was a protective factor from us in the overdose crisis. And that was not the case. So it's made us further, it's given us a slower start to really recognize how this surge is happening and what we need to do.
Can you explain that point? Can you explain that point for us? Because I think a lot of people aren't going to catch that. Black people go to the doctor. Doctors don't want to give us certain drugs because they think we're drug seeking. In other words, I pretend I got a pain level higher than it is, or I pretend that I have a psychological issue that I don't have so that I can get drugs. Doctors think that's what's happening, so they deny people access to those drugs. By denying people access to those drugs, what then happens? Help me connect those dots.
So I think, so there are a couple of things. If people don't get what we saw with the overdose crisis as well, the opioid version of the overdose crisis, is that when people can't get access to manage their pain, they sometimes go to the illicit drug market, right? And so then you're dealing not with prescription drugs, you're dealing with other opioids you can find in the street. I'm not saying that that's always what happened, but what I'm saying is that Black people in navigating addiction, because of the systematic racism associated with the medical system, we tend to have less access to support when we get into trouble, either with prescription drugs or street drugs, because we are surveilled and drug tested and criminalized and monitored in ways that make it harder for us to access the help, which makes it more dangerous for us.
Wow. Well, that danger is very real, and the need for some kind of harm reduction strategy is clear. The question is just what will it look like, and how will the public respond to it, and do we have the political will to make it happen? The work you're doing at Drug Policy Alliance is instrumental in getting us over that hump so that we can get the kind of policy response, medical response, quite frankly, humane response that we all need and deserve. Kassandra, thank you so much for the work that you do, but also for this incredibly insightful and necessary conversation.